Hi, my name is Dr. Mark, and I'm the owner of Smile Dental of Fitchburg. When I was in school, I always really liked science and math. I thought for a while I might want to do physics or computer science, but then I realized pretty early on that I really wanted to be somewhere where I could work with people and really make a direct impact on somebody every day. So I decided to look into dental, and it ended up feeling like a really great fit for me. Being able to work with my hands, being able to interact with people and see people twice a year and see people for a long time and make those long-term relationships with my patients. And also with the opportunity to own your own practice. As the owner of my own practice, I get to treat people the way I would want my family or my friends to be treated. I think the part of dentistry that I like the most is getting people out of pain. When somebody comes in, they've been in pain for days, they haven't been able to sleep, they're not able to go to work, being able to bring them in, help them through their anxiety, and because it's not easy going to the dentist, kind of figure out what's going on, and then getting them out of that pain. For me, there's very few things more satisfying than that. I always like to really get to know what's going on with my patients and what's going on in their lives. I like to know what they're up to. I always like to have a conversation before I get into anything, especially new patients. So, I like to know what brought them in. And I like asking what's going on. If there's a fifth grader, I like to know about their favorite video games or what they like or don't like in school. Or somebody else might tell me about their ski trip, and I really like hearing about that stuff and sharing some of my own stories. When it comes to patient care, I find my role is to really let people know what's going on. So I like to do a very thorough exam, get all the information, look at all the x-rays, and I like to sit the patient up and kind of go through everything with them in a way that's understandable to them. They have all the information they need, they understand what's happening, and they can make the best choice for them and their health. I really like to cook and bake, exploring new recipes and trying new ingredients. Recently, for my birthday, somebody gave me a bread making kit, so I'm starting to learn how to make a little bit of bread. I made some focaccia recently, which I like because you can put a lot of olive oil on everything, and I like to eat a lot of olive oil, so I'm pretty happy about that. It's also hard to mess up, which is good for me as well. I also really like to hike. I used to live in Keene, New Hampshire for a while. So I really like being out in nature, being out in parks. It's very calming for me. It's a very, very peaceful place for me. I like it a lot. I really want this practice to be practice for everyone. I want this to be a place where people want to bring their friends, want to bring their family, people feel comfortable. And I really want to make it a practice for everyone in the community. So people feel comfortable here and know they can come here if they have problems, or even if they just want to come every 6 months to get their cleanings and catch up with the team and the hygienists they've been seeing for the last 10 years. And I want that to be sort of the community feel of the practice.